Okay, so questions come in. What type of surgical mask should I be using? We recommend that practitioners, if they are available, should be using a standard fluid-resistant face mask. Question that's come in is, where can I get hold of face masks? As you'll be aware, the supplies are very limited at the moment. We have asked NHS England and Public Health England to make supplies available to primary care optometry, and hopefully we'll have more news on that in the days and weeks to come. But for the time being, if you don't have access to face masks, please look at our FAQs and consider all of the other behavioural methods that we recommend that you consider adopting if you need to see a patient. So a really good question now about whether is it ethical for optometrists to be asking for PPE such as face masks when our other colleagues in other area of healthcare such as nursing and frontline medicine may have a greater need. And the answer to that is that there is a finite resource of PPE, and we're asking NHS England to consider optometry and to consider whether optometrists or a number of practices should be in the supply chain. However, it's for Public Health England and NHS England to make this very difficult decision as to which areas of the health service have the greatest need for PPE and can do the greatest good with that resource. And that's why in our guidance we've been very clear about behavioural ways that optometrists can adapt their practice to be safe and really focus in on using virtual and telemedicine as much as possible. And really, we really need to increase our confidence because we have so much skill and can make so many really good decisions actually over the phone or via a video call to reduce the number of people who need to come into practice. And if we don't have access to PPE, if NHS England and Public Health England do feel that actually that resource needs to be saved for other sectors and they make that ethical judgment, then we've got recommendations in the FAQ of what you can do to adapt your practice to keep it as safe and to minimise the risk. So one of the questions that has come in is, how can we enforce the use of face masks in practice? And the short answer is we can't. We can, as a professional body, we're only able to make recommendations. However, I can reassure you that with the other stakeholder organisations, we've been working really tirelessly over the last couple of weeks and in conjunction with the regulator, the GOC, to push NHS England an improvement to update the SOP for optical practices and also to put together resources to ensure that both optometrists and dispensing opticians can work virtually wherever possible. However, you know, this is a fast-moving situation. I'd really advise everyone today to make sure that you check the college website daily for updates, check the NHS England website daily for primary care updates.